Speaking of cleaning up and making things look better, you might be thinking about doing that to yourself. And this morning, it's a Great Look Monday. We want to talk about body sculpting. But you know something? If you have the fat removed, the responsibility still remains with you to stay in shape, to eat right, to exercise, and make that new look stay. We welcome in Dr. Sam Shatkin from Aesthetic Associates. Doctor, welcome. Welcome. Well, you brought some toys this morning.
I thought we'd just start out with that.
And right away,
nothing like a visual to show the story.
Nothing like a visual. I'll take this one. You can have one of these others. It's like Captain Hook and
if we're trying to battle, then that would be the right choice. But the reason I brought these is because this is the caliber and the dimension of the original cannulas that I started using back in 1989 when I started in practice.
Yeah.
The smallest cannula I had back then was 6 millimeters. Now the very largest cannula I have is 4.7 millimeters. So if you, I don't know if they can zoom in closely, but you can see the difference.
Let's see if we can.
Essentially what we're doing now,
excuse me.
Essentially what we're doing now is we're sculpting instead of, sucking out. We're sculpting the fat. In fact, this is the one cannula that we use now for the sculpting. So look at the differences in the dimensions.
Let me see if I can put these right up here in front so that you can literally see the difference. Look at that. Look at the difference in those things. And this was 1989. This is 2011.
Right, exactly. So, and there are a lot of new products out there that talk about body sculpting. There's ultrasonic liposuction. There's products that are using cold type technology to reduce the fat. But because we're using these fine cannulas to sculpt the fat now more than we ever were able to do before, the techniques have been resolved to really have easy recovery, minimal surgery, minimal downtime, and we like that. And that's
Doctor,
great.
I've got a question that is really a layman's ignorance and everything, but if it required something this large to suck the fat out of the body, how can the same fat be sucked out with something this small? I thought it would need a larger, a larger conveyance.
First of all, it takes a lot more work to physically do it because we have to pass in and out through the fat many times.
Yeah.
But we're able to sculpt. It's almost like if you're working with a piece of marble or a piece of wood that you're sculpting, you're taking small bits at a time instead of large chunks at a time. And that's what helps refine the areas. That helps define the areas that we want to treat. And the end results are better. The recovery is easier. Minimal downtime.
Now, do you ever have any of this diameter but longer?
Yes, we do. We have different lengths, right? Well, this is the standard length. That's one of a shorter. The little one that you have there is the shorter one that we would use more for underneath the chin to remove the fat there. Right. And this one would be more if we're doing like the hip area. And then we have longer ones for the legs, the thighs.
Okay. Well, I can see this would be minimal invasion.
Very little invasion, right? Very little.
Is lipo, by the way, if you have any questions for the doctor on this topic, please give us a call at 644-9840. Got a chance to talk to the expert about this. Is this becoming more popular? I know there was a time it was extremely popular. Then you don't hear about it anymore for a while.
Well, maybe because there's some other new techniques that are evolved with this, but it's still popular and it's growing in popularity. In fact, liposuction is one of the most prevalent. Liposuction is one of the most prevalent procedures that plastic surgeons perform every year. It's very popular. We do a lot of it.
Where patients are concerned, are there qualifications for candidates? I mean, are there some people that need it but can't have it done?
I'm glad you brought that up, John, because people don't understand that liposuction is not for weight reduction. That's not what it is. In fact, the best patient, and we've got a couple photos to show you, is a patient that's near their ideal weight, that has very localized areas of fat. Here's a perfect example. This woman has the outer thigh lipodystrophy where sculpting can be performed. I just want to mention that these photos are provided by the American Society of Plastic Surgeons and the American Aesthetic Society of Plastic Surgeons. I don't show my own photos because I worry about patient privacy.
Well, sure.
But these are great examples of before and after. You can see how the inner thighs are reduced, the outer thighs are reduced, shaping the legs and improving it. This is not somebody that comes in obese But those patients that do have some weight problems, we'll work with them to get their weight down before the surgery.
That was an incredible difference.
Right,
Really
and now here's a patient that had some liposuction contouring as well as some skin tightening, like a tummy tuck. And you can see how the shaping and the flattening can be dramatically improved. These are surgeries that usually are outpatient surgeries, and a recovery that is somewhere between a few days to a week or so, and that's it. So they get back to their normal activity fairly quickly. So
far, the two photos you have shown have been of females. Do men ever come and have this done?
Absolutely, absolutely. We do a lot of men. In fact, a lot of the plastic surgery that's being performed now is increasing in number of men because men have to compete in the workplace. A lot of men are more physically active, you know, bike riding or exercising. They want to look the way they feel. So they'll come in and we'll do the sculpting for the men. It's great because we'll do the love handles, we'll do the chest on the men, you know, if they've got a little extra fatty tissue that they don't like, and it's a great technique to use. And for the most part, anything that's away from the face is completely hidden with clothing. So they can go back to their work within a day or two after liposuction, and nobody's going to know what the problem was that they had surgery for.
All right, I'm gonna hang on that for a moment. I want to take a phone call first. Good morning. Welcome to the show.
Hi, this is Cindy.
Hello.
Hello.
Hi.
This is Cindy.
Yes, Cindy.
Hello, Cindy.
I have a question about belly fat. Because the health problems associated with belly fat, once you suck that off, is that gone forever? And does that decrease your health problems and health risks? Because they're talking about that so much.
That's a really great question. Thank you, Cindy. First of all, I just want to mention I'm Dr. Sam Shatkin Jr., okay? It says Dr. Todd Shatkin. He's a great dentist, but we're talking about plastic surgery today. But essentially, the question you had is, can it improve your health? And there have been a lot of studies that show that by reducing body fat with plastic surgery, unlike reducing body fat with weight reduction, can still improve the overall health. In many cases, it'll reduce your cholesterol and things like that, but it's not an excuse. It's not a reason to have that done to become healthier. Really, weight reduction is best managed with proper diet and proper exercise, and we're very strong proponents of that. The holistic approach we have at the Aesthetic Associate Center always recommends patients are careful about that.
Well, you know, doctor, if you take a positive approach to this, if someone is contoured and looks greatly different, like the first photos you showed of the legs and everything, that can really be an incentive for that person to then go on and do the things the right way.
There's no doubt. It's a great impetus for people to get on track and start working a little bit better. Sometimes it will take the fat out of like the chin area, and just taking that makes them look like they lost 10 or 15 pounds, and automatically it changes their affect. They feel so much better about themselves, and they're more, you know, confident when they do things at work, and really that makes a difference. But like I said before, even if they're coming in for very small areas, we're on top of everybody. We have supplements in the office to recommend for better wellness. We recommend the weight reduction. We run classes in our office 2 times a week. We run a class in the evenings for weight management. So patients can't get out of it too easily. They gotta understand that they're going to be healthier, and if they want us to do the work for them, they will be healthier.
How long did you say you have been doing this procedure?
Oh, I've been in practice since 1989, but the techniques have improved and evolved, like I showed you with those cannulas. So, but 22 years. 22 years I've been in practice,
now, you said something that piqued a question from me. You said, especially if pertaining to men, if they have any work done in the body, well, they can be back to work and wearing clothes and nothing. That says to me there might be some small scars.
Well, the incisions for the liposuction are only as big as we need to get the cannula through. Less than 1/4 of an inch in most cases. So we're making tiny incisions. So if it's under the chin, it's one and right up underneath here. If it's in the tummy or the flanks, we'll make those in strategic areas, but it's very, very small incisions.
How long does it take those to go away around the facial area?
Well, we have to put some compression on the areas that we treat. That pressure will help keep the swelling and the bruising down.
Oh, what do you mean by compression?
When we're working on, like the tummy, the women will wear a girdle. When we're working on the neck, they have to wear an elastic strap. That strap has to be on there for a minimum of 5 days in my practice to get that swelling to go down enough so they can have it off during the day and go to work.
Okay, so they're off work for at least a week if they have facial done.
Well, minimum of 5 days if they're having the face done, unless they can go to work with it on there. And some people maybe, well, maybe they can. We've had people that work at salons or whatever, but if you're working at a bank or you're in your job.
If you're right here.
If you're on TV, radio guys can probably get back the same day.
There you go, right.
But yeah, but if you want to hide it, you can hide it in most cases.
All right, we have another phone call. Good morning. Welcome to the show. Hello.
Hi.
Hi there.
My name is Sheila. I have a question. I have the fat, what we call the belly fat, the pouch, but I also had a hysterectomy about 6 years ago. And my question is, I have a little scar tissue. Would I be a candidate for this surgery?
Okay, well, if you have scar tissue that's visible on the outside from the hysterectomy you mentioned, sometimes we'll take out some extra skin and do some liposuction contouring all in one, and we can use your previous scar. We can remove that little pooch that you described. Maybe it's a little overhang from some of the fat that's extending over, and we'll go right through the old incision. So we might not have to add any new scars.
Oh, that's great.
Yeah, that's really
good to
great.
know.
That's
And
great
doctor, one last question. What are these things made of? What is this?
The steel, surgical steel.
Surgical steel?
Surgical steel.
Yeah.
Yeah, they're pretty strong.
That's amazing. And of course, you have great products that people can avail themselves of at
always.
the Associates.
Yeah, we do.
Doctor, thank you. This has been a real education. It's been
good.
a lot of fun.
I'm glad we
folks,
learned.
we're going to put up on screen the information you need if you want to get in touch with Aesthetic Associates and Dr. Sam Shatkin and take advantage of this amazing technology to look your best. And then the onus is on you to stay looking your best. You stay there. We'll be right back.